Maggie Spring for News 27 with your weekly health segment. I'm at Gold Country Rehab Center. With us today, we have Scheie Syndrome specialist, Dr. Claire Guimont. Let's go take a look. Hello, Dr. Guimont. Thank you for being here today. Welcome.
You're welcome. I'm your medical specialist, Dr. Claire Guimont. I'm here to better help you understand what Scheie Syndrome or mucopolysaccharidosis or MPS. Hopefully this will also help you understand what people with Scheie Syndrome go through.
Doctor, we have a few general questions to ask you. At what age is this disease diagnosed?
This disease is diagnosed typically in adulthood. Only a few cases are diagnosed in childhood.
That is very interesting. What are some of the effects of this disease?
Some of the effects of this disease include sight and hearing loss, mental deterioration, and limited movement in the joints. Some of these symptoms vary on how severe the case is.
That sounds very serious. Are there any treatments to maintain or eliminate this disease?
Yes, there are two treatments, supportive-based treatment and symptom-based treatment. Supportive treatment includes enzyme replacement therapy for those patients with a defect in the A-literandase. Symptom-based treatment is treating those symptoms that go along with this syndrome, such as heart defects or stiffening of the joints.
Can you tell us how this disease is inherited?
This disease is inherited in what is known as an autosomal recessive manner. This means that both parents have to have a copy of the gene and both parents have to pass it down to their child.
Dr. Guimont, is this disease rare?
This disease occurs in about every 100,000 babies born, so yes, it is fairly rare.
Can you tell us what are the physical characteristics of this disease?
Some of the physical characteristics of this disease include a broad mouth with full lips, claw-like hands, deformed feet, increased body hair, and coarsened facial features.
How would a physical exam determine the symptoms of Scheie Syndrome?
Typically, there would be hearing loss, liver swelling, possible hernias, and aortic regurgitation. Aortic regurgitation is when the aortic valve in the heart does not close completely. This means that every time the heart beats, a little blood comes back into the heart. The tests I would do would be an x-ray of the skeleton, blood cultures, urine tests, and heart tests.
Thank you. And what is the lifespan of a person with this disease?
Well, people can have an almost normal lifespan, although blindness, deafness, and limited movement in the joints may occur and shorten this lifespan.
Dr. Guimont, is there any prevention for this disease?
There is no prevention except for genetic counseling, which is recommended for anyone with a history of this syndrome and their family. There is also prenatal testing available.
Which gene is affected in this disease?
Scheie syndrome is caused by mutations in the IDUA gene, which leads to deficiency in the alpha-lipidolipidase enzyme.
How does this enzyme replacement therapy work that you were talking about earlier?
Let me explain that to you. If given weekly infusions, it leads to improved lung functions and also improved joint movement. It also slows the progression of the syndrome.
Thank you, Dr. Guimont. That was a very enlightening interview. We learned so much about Scheie Syndrome. Now back to you, Ms. Laux, in the studio. I'm Maggie Spring with News 27, and we are back in the studio with Ms. Laux. The scientific name of this disease is mucopolysaccharidosis, MPS, MPS 1, or MPS 2. This disease is also called Hurler syndrome or Hurler-Scheie syndrome. This disease was first noted back in the 1900s. It was called gargoylism. It was not until 1962 Dr. Scheie, an ophthalmologist, noted this syndrome to a lesser degree. The name was then changed to Scheie syndrome. This disease, in its more rare form, is called Hurler syndrome. As Dr. Guimont explained in the interview, this is a metabolic disease that is passed down from parents in which the body cannot break down long chains of sugar molecules. These molecules are also known as glycosaminoglycans. The alpha L iteranidase that Dr. Guyama was referring to is an enzyme that helps people break down sugar molecules. Without this, glycosaminoglycans can build up and cause organ and tissue damage. This disease is inherited in an autosomal recessive manner. This means that both carriers have to have a copy of the defective gene, and both must pass this down to their child. This shows the physical characteristics of Scheie syndrome: prominent forehead, increased facial and body hair, and large mouth with full lips. In addition, clawed hands are part of the physical characteristics seen. This is an example of the progression and severity levels of this disease. You can see from these pictures the slowly progressing disease to the intermediate, and then finally the rapidly progressing disease. This wraps up our in-depth look at Scheie syndrome. Hopefully you learned a lot. Thanks for watching News 27. Back to you, Miss Laux, in the studio. Action!
Okay, ready?
Don't sit on that.